Thank you very much. Can you hear me well?
Yeah.
Okay, fantastic. So, yes, my name is Mira Osinibi. Thank you for inviting me. I'm the respiratory pediatric specialist nurse in respiratory in King's College Hospital, and I'm talking about vaping in adolescents because we embedded smoking cessation in our clinic in respiratory for adolescents as well, but obviously mainly for parents who smoke, and we want to reduce secondhand smoke exposure. So, in previously, as much as I was asking the adolescents if they smoke, not that many, thank God, smoke. But since about 2019, 2020, I had adolescents who were telling me, I don't smoke, but I vape, and they were quite nonchalant about it. So that's when it kind of come to me, the realization that actually we are in trouble, and I kind of anticipated this. Next slide, please. So the communication about vaping now, it's kind of polarized, because in adults, you will see adult respiratory consultants, public health. There's quite a lot of information about how vaping is really good for the smoker. And the education about vaping cessation as a tool, it really outweighs the information education for children and adolescents who are actually taking up vaping now. And we are not talking about now that they probably tried on, because obviously adolescents will, but we are in an era now is that actually some of them have issues to come off it. So my main kind of message is we have to move away from comparison. I cannot hear any more of, but at least they are not smoking tobacco, but at least it's 95% safer. Well, the 95%, first of all, is a number that has been kind of created about 2018. The research about vaping, it's kind of a little bit much more advanced now, but also it is definitely better if a smoker smokes, doesn't smoke and then vapes, but this is really not something that the message we're giving adolescents. Both are poison to the body. If you are vaping, and if you're vaping for I don't know how many years, or if you're vaping excessively, it is also not good for the lungs, either for the adults or especially for adolescents whose lungs are just growing. Both have chemicals in damage lung, and they can damage lungs. Both of them, tobacco has about 4,000 or 5,000, but vaping doesn't have one or two. It also has chemicals that potentially damages the lungs. They are both addictive, and actually vaping can be considered a little bit more addictive than tobacco, regardless if it's safer or not safer. It's really difficult to actually come off it, especially for children. Now, and when they say, well, at least they're not smoking tobacco, and then it's better than, like when somebody is on a methadone, they are not somebody who's obviously addicted to morphine. Nobody will be saying, well, you can have this methadone now forever. There is obviously a proper plan to come off the methadone at what point. So while we are now suddenly saying, well, at least switch this to vaping, but off you go. If you have to do it 25 years, at least you're not smoking tobacco. So how adolescents actually vaping, it's the problem. If an adolescent was vaping on Saturday night out, I might not be so concerned, but they don't. Next slide, please. So why is vaping harmful? And I actually get this a question from, for example, when I was discussing vaping with Lambeth Council, because I wanted kind of their help with education, and they were saying, but why is it harmful for adolescents? So we, as clinicians, and especially if we are working with respiratory and asthma, we obviously, most of us will think, well, this is obviously not good for anybody's lungs, but you would be surprised how many people don't actually know. So as I mentioned, okay, it doesn't have 4,000 chemicals in there as a tobacco. However, it has many chemicals that nobody should be vaping and nobody should be inhaling. One of them is a nicotine, which is very addictive. Nicotine is also not great, even if it's a place as a nicotine replacement therapy, as a patch or as an inhalator. Nobody should be inhaling nicotine 12 hours a day, or even if it's a a legal amount of 20 milligrams in a vape. That's not the point. The point is how adolescents are actually vaping and how much nicotine they're getting in. Propylene glycol and glycerine, formaldehyde, acrylane, diacetyl flavorings. For example, many adolescents, even some parents, when I talk about flavors, they will say, oh, it's only strawberry or it's only melon, but they don't understand to make a strawberry or melon flavor in a tiny elf bar is a huge science, because they are quite small. It has to taste nice. It should not give you any side effects immediately. You shouldn't cough. It should kind of have a really nice, flavor, taste, and everything, which means that you need other chemicals to actually make this happen. So 1 or 2 flavors in a vape can be made out of 100 different chemicals just to make that strawberry and melon. Plastic, copper, and lithium battery. If somebody is having that vape in a mouth and sucking it most of the time, even if it's not a tobacco that is combustible, the battery, while you are reheating it, and if you're reheating it often enough, cannot be good for you. Next slide, please. What are the harmful symptoms? So actually, I have quite a lot of research and loads of discussion with Professor Andy Bush, who is the respiratory consultant in Brompton, and he's very invested in talking about vaping and how he's not happy about the vapes to be in the hands of adolescents. He is the one, and I agree with that. We have to understand the acuteness, the acute toxicity of the vape, that you can't compare it with tobacco. Now, we have adolescents who are coming, to A&E or some places where they were excessively vaping, and then you can see some admissions with excessive vaping where the acuteness of the pneumonitis or the acuteness of the inflammation of the lungs is very quick. They are not vaping for 15 years. They've been vaping for maybe for 2, but constantly. And, as much as tobacco is bad for you, you don't see any smokers who smoke 10 or 15 a day running to A&E or GP in about a year saying, I can't breathe. It obviously takes longer. It's much, much worse. It's, there is a higher chance of having a cancer, but the acuteness of the inflammation of the vape is quite special to quite specific for the vape. Chest infection, such as pneumonitis. Some adolescents who excessively vape, they can get pneumothorax as well. I have dentists who were speaking to me and wanted to do for me to talk to the services, because they can see that adolescents and some younger people, younger adult, would have a excessive dry mouth because of the nicotine. They will have mouth ulcers when they stop vaping and they come again to the dentistry. The ulcer is gone, obviously has to be treated. They can have increased dental cavities. We have sleep disturbance. We see that with adolescents who are scrolling with their phone overnight and hiding the vapes. They're scrolling on their social media, which is now associated with vaping. So, when you're talking about an adult, when you says, well, I'm a social smoker only when I'm in a pub and I see a drink, this is the same thing that happens to adolescents when they associate social media now with vaping, and especially at night when everybody's asleep, nobody can see them, they are bored, they're anxious, and that's what they do. And that's when the nicotine kicks in as well. Huge addiction. It can increase the heart rate, especially if you have increased nicotine consumption. And there is a study that actually showed the nicotine and the actual vape stiffness the arteries and eventually leading to increase of blood pressure. So I'm not saying that the adolescents in your clinic who vape suddenly have a high blood pressure, but this is something that is leading to. Next slide, please. This is just a sample of a digital NHS input. This is for England. So I just kind of got out, there is adults and children and the whole year. So I just take out the years that we are interested in. So it's really important that actually now there are admissions in hospitals which are actually put onto the NHS England as admissions because of primary diagnosis of a vaping between 9 and 19 years old were 6, and the secondary diagnosis was 40. Now, this is quite a small number, let's say, because it's, when we talk about England, this is not a King's College Hospital. And even with some of our clinicians, not everybody's asking, do you vape? So, some children might have pneumonitis, might be admitted, and they will say, I vape, and they will kind of brush it off and they say, well, it cannot be because of that. So you have to appreciate that not everybody will be putting this as a primary or secondary diagnosis. So this could also drive the small number of how many people recognize that some of the vaping admissions are because of that. Next slide, please. Now, this is just a little bit of a data of adolescents that are referred to me or I see in my clinic. So I mentioned that I have, this is what I do. It's implemented, the smoking cessation service is implemented in our Thursday clinic, which we have the most patients in. So the clinician will say, do you smoke or do you vape? Or, we do. Can you see Mira, who is a specialist nurse, and she can discuss this with you. So when we're talking about the vaping, I have a data now with all the adolescents, and I might have actually referral from other services from King's. I can't take too many because obviously I don't only have a smoking and vaping cessation service, but I will take some. Now, we have the 70% of referrals is literally of the vaping just in 2023 or 24. So I had few 1990, 2021, obviously there was a COVID, but there was a surge suddenly from 23, 24. And what happened in 23, when you look at it, is that you see more disposable vapes in the shops. And this is really correlates with the amount of referrals and everybody's asking for help. Next slide, please. So when I'm looking at the data, just for the interest, when I ask them, so the average age of referral, the children are about 15 years old. But when I ask them, when did you start vaping and constantly, not only when you started vaping once or twice and then you haven't vaped for another 3-4 months, they started vaping constantly from the age of 13. So it looks like a year 9 is a crucial year where the children go from like, I'm just trying it on, I am doing it every single day. Next slide, please. So what others are saying, so this is not just me, and this is something that I'm kind of trying to kind of get information from others, and this is really important that I think we need to kind of join the data because I get emails from other services to say, can you help us, because this is what we see in our services. Next slide, please. So, for example, Evelina Hospital. So I closely am talking with Evelina Hospital, the asthma team, and I had a meeting with the respiratory specialist pharmacist, Sukeshi, and this is what she said to me. This is what they see. Next slide, please. So they see the adolescents that vape, and obviously she's embedded in their service. She's really important part of their service, and then she sees all the asthmatics and the children who vape. What she's saying is there is no vaping cessation in the community. There is an inequality within pediatric service. She can't see, she can't have a clinician to say, what do you want me to do? Can you prescribe this? Can you do this? What should we do? And she has nowhere to go. She doesn't know what to do with these adolescents vapers who have issues. Struggle to refer a young person. Parents get conflicting information. They think, well, is it 95% safer? Is it okay? Should I just leave it because my child is not smoking, or where is it coming from? No guidance for pharmacies with nicotine replacement therapy or vaping cessation. So this is something that I spoke to more than just pharmacies, and this is really difficult for them because there is a vaping cessation guidelines now for adults. When they mention, ease down of the vape, cut it off, cut it down. We can't tell an under 18 years old, what, I know you vape, but can you just buy it and can you get it a little bit less, please? Because obviously they're not supposed to buy it. So there is no real vaping cessation or nicotine replacement therapy for children for under 18 anywhere. GP is resistant to help with vaping cessation because they said we are not paid for this. They will say, we need guidelines. I don't know where to go. When I say, well, there is a vaping guidelines, vaping cessations, that you can actually use the Nicorette inhalator, but they are really looking for something from Public Health of England, just to see, this is something that is very specific. So if I ask the adolescents to go to GP for referral, the GP will just refuse them. And schools are desperate to help the young adolescents because they can see they actually, if an adolescent is already vaping quite a lot, of course they will not be stopping for 7 and 8 hours at school. That's not what person with addiction would do. So that's the problem as well. Next slide, please. I was speaking to the CNS nurse Ashira from Evelina Hospital. She's an asthma nurse. This is what she says. Next slide, please. She said, we are seeing children as young as 11 with vaping habit. The adolescents, we see this close to us, they pick up a vape on the floor and try to get the drag. The patients are saying that like it's really easily hidden. They don't have a problem to get it from a shop. Peer sharing vapes is very common. The problem is that they don't have enough education and they don't know how not great it is for them, so they share. And then because they share it often, they say, well, actually, I'm going to buy myself my own one. So it always very, very often it starts with sharing, and then they say, okay, I'm going to buy my own one. What they don't know what to do about vaping. They don't have referrals. They ask about the history of vaping. They talk about the vaping harm because I already had a discussion with them. We had a really good talk, and I'm empowering them with the information that I can give them as well. But they don't really have any guidelines. Again, they don't have any leaflets as well, and they have nowhere to refer them to. Next slide, please. Teachers as well, as you know, vaping at schools is a serious problem. It's not about they catching 2 adolescents per month because they would not be complaining. But this is an increased problem for schools. And again, they don't have any guidance from the government or from public health, from anywhere. They just know they have to tell the pupils to say, you can't do this here. We confiscate it. We can even look in your bag if we need to. We will tell the parents, don't come to school for 3 days, and that's it. But you're not going to do anything about this because this pupil, if they're truly addicted, they will just vape again. So they are in kind of a loop and they're quite concerned. Next slide, please. So this is the report from the union when they've done a survey in 2023 about vaping. They have about 4,000 members. It disrupts their own education and others. People vape and they self-regulate their mental health. Sometimes they say, look, I'm anxious and I think I need to vape. And they really think that the vaping is going to help them because all they have in their mind is that, well, I think I heard that the smoking is calming people down. So they are using it as a kind of like a soothing kind of a thing. Also, quite a lot of students vape in the toilet. They hide their vapes in there. And what we are concerned about, specifically for asthma children, is that we have now patients who will tell us, I'm worried to go to the toilet because I know somebody vaped in there. And when I going in there, it's quite strong. The smell is quite strong. They don't necessarily have an asthma attack, but they already feel that it's going to trigger them. So I a couple of times have to tell the schools and email them to say, I'm sure aware that you have a couple of vapors. Can you please find out and can you do something about it? But they can just put a vape alerts alarms in there, which cost about £4,000. But the alarm goes off and then they go there. Nobody's in the toilet, so everybody knows they have vapors, and the alarm just tells them so. Next slide, please. So yes, local and independent secondary schools are really worried, and I've done my education to them. I offered to do an education for the schools in their classes, and so far since 2022 December, I reached about 16,000 pupils because I just felt that I see the adolescents in our service, but that's like about 0.5%. Especially like in Southeast London, and most of the children in schools have no idea why they should not be vaping. So we can't be surprised that children vape because it's a novel thing. It's really accessible. It has been designed to be quite, addictive, especially to kids. So, if we don't tell them why, and if we don't tell them, you will be surprised that if you buy one vape, don't think it's going to last you for a year. We can't be thinking that, well, how come they vape? Next slide. So this is just the same as with what I was talking about before. But the main thing is that they lack support in terms of education, and they also lack the school nurses lack support. For example, the school nurse can't really kind of do the education for them because she doesn't know herself. So I'm trying to also do teaching for the school nurses to empower them to do the same talk as me if they find a childhood that vapes, and then they speak to them one-to-one. But now we have an issue. Then what next? What was the school nurse will say? To say, okay, so this is bad for you. I know you're addicted. Let's talk about this. But what else? So that's where we are kind of lacking out. That's what is lacking at the moment in community. Next slide, please. So I have messages from the primary care as well. So especially Dr. Bomley, I had a very good talk with her, and she is a GP who also does. It's really interesting because I spoke to her kind of virtual, and I saw on her email she's very concerned about this vaping, and also with adolescents, and also how much education it's about to adults, and then how much of the free vape is given to everyone, and that kind of message is really conflicting what she sees and what she thinks is a problem in pediatrics. So and also she told me that she also does I don't know how it kind of works, but I know she does some work for 111. And then, she has several phone calls from parents to say, my child vapes, my child has a chest pain now, he's been coughing, what do we do? And then obviously, in 111, if because the mom, will say, or the dad will say they're vaping, she will say, please go to A&E. But the message is that it's increased amount that she's getting a phone calls from 111 to say, my child is vaping, this is what my child is feeling now. Next slide, please. So what she's saying, she thinks that we over promote vaping as smoking cessation tool for adults, and we disregard adolescent use of vapes. Vapes can be as addictive as smoking a cigarette, like this is less harmful. She believes that repeating a history of using the cigarettes, prolonged vaping harm in years to come for adolescents, lack of leaflets about the harm of vaping to children and adolescents, and our pediatricians and A&E consultants seeing rising admissions in the departments caused by vaping. So I just wanted to kind of get other people's opinions and what they see, not just what I feel, not what I just see in my clinic. Just kind of other people's perception of the vaping and what they struggle with. Next slide, please. Next slide, please. So what are we doing? Not much, to be quite honest. So I am in a situation where my step is, the first one was education, and it's brilliant. I'm educating other clinicians, I'm educating other services, networks, brilliant. But what's next? In my education in schools, I will say, ask for help. The adolescents will say, okay, you know what? I think I am addicted. Ask for help. And they will ask for help, but there's nothing. So it's really difficult for me to say ask for help, and then we have nothing for them. So for example, there is Solution for Health. They do smoking cessation services, including vaping cessation. But again, really just for adults. So all of these ones, it's mainly decided for adults. So the only people that actually do something for vaping is the school nurse of Isle of Wight, and then she actually done dissertation about vaping in adolescents, and then she's as passionate as me, and she put herself into, she wants to embedded service in the place where she works, is that she's doing the vaping harm for the adolescents education, and she gets referrals, and she goes to pupils' homes even to do home visits. So this is quite an extraordinary, and I'm not expecting every school nurse to do that, but as you can see, there is very, very little about what to do with an adolescent who vapes. Next slide, please. Now, I am trying to kind of work with other services, and especially with Professor Andrew Bush, that I am kind of collaborating, because I need a really kind of powerful clinical message along with me to other people, for example, like Lambeth Together. I'm working with Society Inside, which is a non-profit organization, and they have quite a lot of people that can influence the government, for example, in terms of they need to get the clinical aspect of in pediatrics, how it's problematic, the vaping with adolescents, because there is quite a lot about smoke-free 2030, but there is not much about wait a minute, we have an issue with adolescents now. So we need to really, put that into the debate as well. It's great that we want adults to stop vaping, to stop smoking and vape instead. But what about adolescents? We have Evelina and asthma services that I'm trying to kind of get data together, because we would like to get data of all the adolescents that vape, because it's a little bit haphazard now. And I am working with Lambeth together, because I am trying for them to get more education in community, at least in Lambeth first, and also to persuade them to put money into vaping cessation under 18. Somewhere, I don't know where, smoking services, especially smoking services, which they don't have anywhere. But it's just, this is some kind of a discussion that I'm trying to have with them. Next slide, please. So my whole message is, I don't know, I am pretty sure that most of you know that vaping in adolescence is not good for them, especially for asthma. We know there is acuteness of toxicity in vaping. We can presume it's not good for you in about 30 years' time, but we also know enough. We don't need to wait another 50 years, just like when we had with tobacco, that is actually, vaping is not great for you. Okay, we need to get away from this, at least not smoking tobacco. And I think we need to start working on the education worldwide, and how we can embed it in our services and your services, education about the vaping, and also ask the councils to do something in the community for the children who already have these issues, to help them. Thank you.